The Stavroполь Regional Clinic has been in operation since 1913. Today, the hospital is the largest multidiscipline medical and preventative institution in the Stavroполь region. The hospital belongs to the third level of medical care, providing, as the leading multidiscipline medical institution in the North Caucasian Federal District, it provides specialized care in 50 specialties, including high-tech medical care in 12 disciplines. The neurosurgery department of the hospital is equipped with the full range of diagnostic equipment, including magnetic resonance imaging and computer tomography, functional diagnostics and neuromonitoring devices. The department provides surgical support for patients with cancer, degenerative diseases of the spine, damage to the upper cervical spine, vascular pathology of the brain, hemangiomatous compression fractures, metastasis in the spine, congenital pathology of the brain, craniocerebral and spinal injury, tumors and traumatic damage to the peripheral nervous system, inflammatory diseases of the brain and spinal cord, consequences of traumatic brain injury. The Department of X-ray Surgical Diagnostics and Treatment Methods performs diagnostics and medical interventions for diseases of the heart, brain, aorta, brachiocephalic, renal and peripheral vessels, malignant and benign neoplasms of various localization, congenital malformations. The priorities of the staff department activities are the treatment of patients with acute coronary circulatory disorders. The department performs operations for the X-ray surgical correction of congenital heart defects in children, cerebral arteries, lower extremities, kidneys, and aorta. It also carries out embolization with prostate adenoma, embolization with variocele and ovariocele. In order to prevent pulmonary embolism, emergency cava filter implantation procedures are performed in patients with lower extremity vein thrombosis. The procedures are minimally invasive and less traumatic for the patient. The ophthalmology department has advanced technical equipment, cozy and comfortable operating rooms, as well as a professional and experienced team. The department collaborates with the largest ophthalmological clinics in Russia, such as the Medical Research Institute named after Helmholtz in Moscow and the Federal State Institution IRTC Eye Microsurgery named after the academician SN Fedorov in Krasnodar. Doctors of the department regularly participate in international ophthalmological conferences. The surgical department of organ and tissue transplantation has operating rooms with an autonomous system, giving laminar unidirectional flow of sterile air, completely eliminating the penetration of dust and unprepared air. The operating rooms are equipped with the latest surgical and laparoscopic equipment and anesthetic consoles, which are able to function autonomously in case of an irregular supply of electricity. Since the opening of the department, more than 1,500 surgical interventions have been performed, 2/3 of them laparoscopic, after which patients go home on the 3rd or 4th day. The department plans to carry out a wide range of surgical interventions on the organs of the thorax, abdominal cavity, as well as endocrine organ surgery. Already today, several kidney and liver transplantations have been performed. A heart transplant is planned.